Welcome to Medical Marijuana and Wellness. Today's topic is arthritis and medical marijuana, a condition that really bothers a lot of people and is one that medical marijuana effectively addresses. Joining me today is Amy Green from MMTC of Florida, an RN and a BSN. Amy, welcome.
Hey, it's always wonderful to be here, Mark.
Great. Listen, let's jump into this presentation because it has a lot of really good information for folks. Let's start off by starting off with what is arthritis?
Yeah, so arthritis is the inflammation that many patients have in their joints. It can include joint pain, redness, minor swelling, a sensation of heat. You can also have arthritis that is associated with other conditions such as fibromyalgia, lupus, or injuries to the joints.
There's really a couple different kinds of arthritis. There's, osteoarthritis and rheumatoid arthritis. What's the main difference
Yeah,
between them?
sure. So osteoarthritis is going to be arthritis that is characterized by a breakdown in cartilage in the joints, typically in the hands, hips, knees, and spine. And then you have rheumatoid arthritis, which is actually an autoimmune disease. And that's characterized by serious inflammation of a joint's interior lining. And this usually causes severe pain, permanent joint damage, and disability.
Sure. And I think in both cases, we're seeing a lot of inflammation. That's the real key, which is leading to a lot of pain.
Absolutely.
So let's talk a little bit about what medical marijuana can do and what it can't do. I know what it can't do is it's not going to cure it, arthritis. It's not going to reverse it. And it's really, the key is it's not going to cause any fatal overdoses. So that's what we know cannabis can't do. Tell us what cannabis can do.
Yeah, so one of the main things is cannabis is going to help reduce the patient's pain level, and it's going to mostly do that by reducing inflammation. When you're reducing inflammation, you're reducing the pain that is caused by that inflammation. Cannabis can also help improve overall physical health and then help with anxiety and stress that can be caused by arthritis.
Yeah, and this is really interesting because in many cases, people don't realize that their pain is coming from inflammation. They think that there's something going on that is causing the pain that has to do with their joint, but really it's that inflammation of the joint that's really causing it. And we're going to talk a little bit more about that, but that's a key component of this. Now, the question becomes, is cannabis effective? And we have some research studies, and I think this is important because these show that cannabis is effective, but also researchers have found, for example, CBD to be quite effective with arthritis.
Absolutely. And so CBD is the non-psychoactive part of the cannabis plant. It does not produce any high or headiness, but it's still very, very effective for pain, improving physical function, and improving sleep quality.
Right. And this is really coming from, this was published by the Institute of Cannabis Research from Colorado State University and published in the Journal for Cannabis Research. So, these are good research studies that we're following up. There's also one that I found really interesting from the Arthritis Society where they reviewed, and this is a recent one for 2022, but they had a number of people that came out and said, it can't cure it or slow the progression, but it may help a lot of people with the pain and inflammation. This is an important study from the Arthritis Association.
It really is. This is really showing that medicine, as we know it, is starting to recognize the medical benefits of cannabis. And we're starting to finally get that peer-reviewed research that is corroborating that.
Right. And a lot of people are going to say, well, wait a minute, research for cannabis can't be done in the United States. It's a Schedule I drug. This research was done in Canada. And so our friends to the north are helping us out with a little bit of research because it is legal up there. Also, Harvard University did an interesting study that said 1 out of 5 people who they consulted with a surgeon is using cannabis. That's an interesting statistic.
It really is. It really shows you that patients have been, doing this on kind of their own agenda without necessarily talking to their doctor. And we always recommend that patients consult with your doctor about all medications you're using, including medical cannabis.
Yeah. And it's interesting in this study because they found 9 out of 10 of these folks said that it helped manage their pain. 4 out of 10 said it decreased their reliance on other medications. And 6 out of 10 said it was the most effective medication that can really help them. And I want to point out, cannabis is a medication. It is not a drug. It is a plant that acts as a medicine. And I think that's important distinction. And we'll talk about that a little bit later about how this affects your body. I think that I'm not trying to overly do the studies here, but I just want people to understand this is something that's really, really important. These are different studies done by the Arthritis Foundation, and they're kind of surprising, at least from my standpoint, how positive they are.
Certainly. I mean, 79% of surveyed people are currently using CBD or have used it in the past or are considering using it. And then 71% of patients who reported using CBD had improvements to their sleep. 94% of the people who reported using CBD were using it to relieve their pain. 67% of patients were using CBD as an effective way to improve their mental health. And then this one is interesting. 66% of patients reported talking to their doctor about CBD. CBD and cannabis medicine are something that not a lot of physicians are currently trained in. And we can only hope as time goes on that our general practitioners and our specialists become more interested and accepting of cannabis as medicine.
Now, that's an excellent point. But this really shows the efficacy of cannabis, again, done by the Arthritis Foundation. And these are studies where they had what they call anecdotal studies. They found patients that were using CBD and got information from them rather than trying to conduct a clinical study. Now, all this is really great, but really what it boils down to is if you look at how effective cannabis is, we have something called PubMed. And PubMed is where we publish here in the United States. It's the library of all these studies. It's interesting. There's over 100 different articles on the efficacy of arthritis in medical cannabis.
Absolutely. A lot of these studies, again, are not coming out of the US. They're coming from Canada, Israel, oh gosh,
The
where else?
UK, yeah, the
The
UK,
UK,
Spain,
Spain.
yeah.
So many other places are producing this information and we are benefiting from it. Time and time again, research is showing that CBD is safe and it's a useful treatment for OA joint pain. It's going to help relieve pain and inflammation associated with arthritis. And it has the potential to treat arthritis pain. That's kind of the bottom line.
Yeah, and it's very effective. And it's interesting. PubMed is a free publication that you can actually get online, and you can take a look at any of these studies, which I think is very effective. But the point is, this is where doctors go to be able to find information on processes and procedures and remedies to help their patients. So the information is out there. So let's talk a little bit. Talk a little bit about why this works. I mean, we talked about if it works. We have something in our body called the endocannabinoid system. And the endocannabinoid system is really broken down into a couple of components. One of them is the nervous system, which we've known about for a long time. We know that we have nerves throughout our body. We hurt ourselves, let's say we hurt our finger or our knee, that signals transmitted through our nervous system to the brain. I look at that as the cell phone system of our body. And it says to the brain, hey, Houston, we have a problem. And then Houston goes and does something with it. Now, for years, the medical profession has been trying to study or been studying what does Houston do with it? What does your brain do with it? And this is where they've run into basically had some trouble identifying that until they started studying medical cannabis and found out the nervous system works in concert with an endocannabinoid system. And the endocannabinoid system is made up of CB1 and CB2 receptors throughout our body that helps regulate things like memory, emotions, appetite, sleep, temperature control, meaning pain, inflammation, immune responses. I mean, this is a rather remarkable breakthrough.
It really was. It started to explain more of the signaling processes that our nervous system is actually doing throughout the body and how it's sending those signals.
Yeah, and it's interesting. The CB1 and CB2 receptors were really, and you look at them, the CB1 receptors, which are primarily in the brain and the spinal cord. CB2 receptors are mainly in are the main central part of our body in the extremities, and these really help to regulate our body, put our bodies in what they call homeostasis. The reason it's important is because the CB1 receptors really act like gates to open and close the neurotransmitters in our body, meaning the receptors that really help us out. Tell us a little bit about this. This is kind of an important breakthrough, both CB1 and CB2.
Certainly. So CB1 receptors, again, they're mostly going to be in the brain, central nervous system, and spinal cord. So they're going to have a huge effect on pain responses throughout the body. Now, our CB2 receptors, these are mostly going to be in the peripheral areas of our body on white blood cells and in some major organs. So when you have a response to a CB2 receptor, this would be signaling pain, because a lot of these are coming from outside the peripheral areas of our body. So think of arms, legs, knees, joints. That is where those receptors are mostly located. So cannabis is contacting both the receptor that is responsible for picking up those pain signals and the receptor that's responsible for picking up those inflammation signals.
Right. And this is really important because what's interesting about cannabis is these endocannabinoids, which our body produces for the endocannabinoid system. This is something our body produces. As we get older, like older senior citizens like myself, we don't produce as many endocannabinoids as we did before, but supplementing it with phytocannabinoids is really an important part of it. And the cannabis plant phytocannabinoids, they're rather unique. Tell us about their unique capabilities.
Yeah, certainly. So endocannabinoid, endo meaning inside, these are the cannabinoids that our body is naturally producing. And then phytocannabinoids are what we would get supplemented from the cannabis plant. So what we are doing is we are supplementing our naturally occurring system with phytocannabinoids. And this is helping to bring our body back into balance or into homeostasis.
Yeah, and it's important to point out that, for example, as a senior citizen, I'm not producing as many endocannabinoids as I did before. Phytocannabinoids help, but also if I have an injury, I need additional endocannabinoids. So the phytocannabinoids help the body be able to basically manage itself and try to put us back into that balance that we're really looking for. This is a rather remarkable breakthrough and something that every person has. Now, this works with both hemp and marijuana. In other words, this is the CB1 and CB2 receptors are open to and work with both of these, but there's a little bit of a difference between them. Tell me the difference between hemp and marijuana.
Yeah, so hemp is classified as a variety of cannabis that has less than 0.3% THC. Hemp has a lot of common uses: textiles, hygiene products, paper. Um, it is not associated with the high that patients often associate with cannabis. And hemp is federally legalized in every US state. On the other side of this, you have marijuana. This is what people usually think about when they hear the word marijuana. This is any cannabis plant that has over 0.3% THC. So if somebody is growing a hemp plant and it ends up producing more than 0.3% THC, it is now marijuana.
Yeah, that's an interesting legal distinction that really has really defined these two products because the 0.3% is a THC content for defining hemp really is a legal concept. The plant cannabis is made up of both hemp and marijuana. Just one is a low THC and one is a high THC. And this is very important because in one case, hemp can be basically bought over the counter and shipped between states, where marijuana has to be regulated on a state-by-state basis.
And that's correct. Yeah. And then finally, you have the differences in appearance between the plants. Hemp tends to be tall, lean, shiny leaves, and then marijuana is more of a squat, bushy plant with fuzzy buds, or trichomes, little fuzzy bits on the end of the flower.
That's why they call it weed, right?
Indeed.
Cool. So let's talk a little bit about what the components of cannabis both in hemp and also in marijuana. It's really broken down into three major components. Tell me a little bit about these.
Yeah, so you have the cannabinoids. These are going to be the things that most people think of when they think of cannabis. This is going to be your THC, your CBD, and then your minor cannabinoids as well, like CBN, CBV, CBG, and so on. Finally, then you have terpenes. Terpenes are what's going to give cannabis its smell and its taste. So this can be, for example, linalool, which is also a naturally occurring terpene found in lavender. It's also naturally occurring in cannabis, and it can give the cannabis a florally scent, but it can really help with relaxation. And then finally, you have flavonoids. Flavonoids, very similar to terpenes, they're going to contribute to smell, taste, color of the plant. And they're also going to have some very important therapeutic benefits, including being an antioxidant, working as an anti-inflammatory, neuroprotective, and they can possibly help with disease prevention.
And this is very important. And working together, it causes something called the entourage effect. In other words, 1 + 1 is really 5, not 3. This is where they complement each other. Give me some examples of that.
Yeah, so when we put all of the different parts of the cannabis plant together, they're working the best. So take, for example, when a patient is using a product that has THC in it, by adding CBD, we're going to lessen the psychoactive effects of that THC just by adding that CBD. Another way is that terpenes are going to enhance the medical benefits of the plant. So if a certain plant has a lot of linalool and limonene, we know that we can expect some certain medical benefits based on that terpene profile with the cannabis, with the THC and the CBD together. And then finally, when you put THC and CBD together, seriously, they enhance their medical benefits. The way that I think of it is THC is doing a lot of the heavy lifting. It's helping with pain, inflammation, relaxation, and CBD is there so that you don't feel stoned or heady, but it's also providing help with pain and inflammation.
Yeah, and it's important to get a product that has both THC and CBD and the terpenes together. The terpenes provide a lot of the medical benefits. The THC and CBD really are opening up the receptors for the terpene medical benefits of the terpenes and the flavonoids. Um, or mainly the two main cannabinoids that we really talk about, although there's 120 of them that we're studying, are really CBD and THC, delta 9. What's the difference between them?
Yeah, so generally CBD is going to be found in hemp. It can be found in the cannabis plant, but it will usually be found in very low amounts. Now, CBD is not psychoactive. This means that it will not give you a high, stoned, heady feeling. And it does this because it's mostly targeting CB2 receptors, which are in the periphery of the body. So think in your joints, in your organs, on white blood cells. And then you also have delta 9 THC. This is what people think about when they think about cannabis. This is the part that can be psychoactive, and to legally be considered to legally be considered marijuana, it is going to have, again, 0.3% THC or more in the plant. Now, THC is mostly going to target the CB1 receptors. Those are going to be the ones in your brain and central nervous system and along your spine. And so that's really going to target those pain signals and the inflammation signals as well.
Yeah, and in targeting the brain and central nervous system, that's what hence causes a lot of the psychoactive effect. Now, it's important that both of these working together is what you want to look for if you want to address arthritis. Now, the CBD receptors, although both of them work with CB1 and CB2 receptors, the CBD cannabinoid actually handles more receptors than just CB1 and CB2.
Yeah, CBD is actually a really, really neat compound just because it has an affinity for so many different receptors in the body, not just CB1 and CB2, like you were saying. So there's 5-HT, which is a serotonin receptor. That's going to be responsible for your digestive process, blood flow, breathing. The A2A receptor, which is a part of your inflammatory system and responsible for coronary circulation. Then you have VR1, which is responsible for body temperature and pain. And then the GRP55 receptor, which is responsible for blood pressure.
So really, CBD is acting as, in essence, a super vitamin for our body.
It really is. Yeah, it's going to touch on so many different parts of the body and interact with so many different systems within our body.
Sure, which is really great. So, and then this just breaks this down. I don't really want to go spend too much time on this, but I just thought I'd break it down for everybody. You'll get a copy of the presentation as a follow-up to this, but what you're able to see is how each of the different cannabinoids attacks or works with a receptor that provides a very specific function. This is kind of interesting, isn't it, Amy?
It really is. It just shows you how how much we're still learning about this plant and how it's interacting with our body.
Yeah, and why it baffled people for a long time is why it works so effectively. And as we're doing the studies, actually studies being done overseas, we're finding out it has a lot of medical benefits, and really something that's really important. Now, we talked about the terpenes being the key to the medical benefits. What's interesting is here's like the top terpenes that are out there, but look at how many of them address inflammation.
Absolutely. And beyond just addressing inflammation, many of these are also an analgesic, which is a pain reliever as well.
Hmm.
So when you combine these terpenes with the flavonoids and the cannabinoids, so your CBD and your THC as well, that's what's really providing that whole medical benefit is everything together.
Hmm. And that analgesic capability, you see it here with myrcene, is something that's really, really important. But you see it with linalool, you see it with myrcene. This is really important. When you go and you're starting your cannabis regime and you have arthritis, take a look at products that have linalool and myrcene in them. It'll help you quite a bit. When you go to the dispensary, caryophyllene, myrcene, and linalool are going to be the primary terpenes that you're going to want to be looking for. Let's take a look also at where you find them. Now, let's use a word that's kind of new to a lot of people, cultivars. What a cultivar is a lot of the dispensaries are now making products to address very specific medical conditions like arthritis. And these are some of the top products, aka cultivars or strains, that are being made for arthritis. And you'll notice some of them are very heavy on CBD and some of them are very heavy on THC. It really depends on your body and what works best for you. But notice, as you're mentioning over here, Amy, all the analgesic effects.
Absolutely. And this really goes to show that you do not need a product that is high THC to get the medical benefits of the cannabis plant. So ACDC, Cannatonic, Harlequin, Canasu are all great examples of products that are not high THC. They have a majority CBD and less THC, so you're really getting those benefits throughout your whole body. They're going to have very strong analgesic and anti-inflammatory properties.
And again, if you're going and talking to your dispensary about a product, stick with the effects you're looking for, which are the analgesic, the anti-inflammatories. And if they don't exactly have this exact strain, they will have strains that do have that terpene profile. Again, the myrcene, the caryophyllene, and also the linalool is something that you may want to take a look at. I think pinene is also a very good pain reliever, but I think you have to be careful of pinene because it does bring back short-term memory, which if you have PTS could be an issue. But this is very, very important. Don't worry about the exact name of the strain. Pay attention to the terpenes, and you'll get the products that you need to help you out. Now, Amy, we also have a couple of different options in being able to take it. I know a lot of people say, well, gee, I'll just smoke a joint and it's going to get rid of it. I don't have to worry about it. But there's a little bit of a problem using flower if you're just rolling and smoking a joint, isn't there?
There really is, yeah. Cannabis has all of the different parts. So the cannabinoids, the flavonoids, the terpenes, all of those different compounds actually burn off at various temperatures. And all of those temperatures are below what fire burns at. So when you actually light a joint, you're burning off a lot of the medical properties of the product. So you're getting not as many terpenes, not as many flavonoids, not as many cannabinoids when you're actually lighting that on fire and inhaling.
Yeah, that flame, when you put that flame up there, that 550-degree flame, you're going to burn off a lot of the medical benefits of cannabis. It's really a better idea. And also, you're putting burnt material into your lungs. Probably a better idea to use what they call a dry herb vaporizer, isn't it? If you want to smoke flower.
Yeah, certainly. If an inhalation route is something that you're interested in, we actually always really recommend a dry herb vape. This is going to be a product that is going to heat the cannabis by either conduction or convection, and then vaporize the oil from the plant. And that is what you're inhaling is only that vaporized oil from the plant, and you're not combusting the actual plant material. So you get all of that plant material left over afterwards.
Right. And if you don't have a dry herb vaporizer, you can buy a vape pen from your local dispensary. And I should point out, although there's been some bad press on vape pens 5 years ago, vape pens from Florida or from medical marijuana licensed dispensaries have been tested twice in-house and once in an outside firm. So they're medically safe to use. I think that's an important point, isn't it, Amy?
It certainly is. Obviously, a couple of years ago, we had people with the popcorn lung or the vape lung. A lot of times they found that that was from the addition of vitamin E acetate as a cutting agent. So these pretty non-reputable companies were bulking up the actual product by adding in vitamin E acetate, which was truly detrimental to many patients. Just letting patients know that that is not an approved substance in the Florida medical cannabis market. So that's not something that you would ever have to worry about at a Florida medical dispensary.
Yeah, and probably using a vape pen is a lot healthier, I think, than using flour. Because again, I don't like that burnt material going into your lungs, but also concentrates, which are really taking the cannabis extract, putting it into a couple of different forms where it could be, again, vaped through a dabbing or a vape pen process really, really helps. But I think for arthritis, one of the main things that can help you are topicals.
Absolutely. So I always tell patients that there are two types of topicals that they'll run across. One is just going to be a localized kind. So you wake up, your knee hurts, put some on your knee. It's only going to help your knee. And then the other kind is a transdermal topical, meaning you wake up, your knee hurts, put some on your knee. It's going to help your knee, but then it will go through your skin and into your bloodstream and actually provide medicinal benefits throughout your whole body, even though you only applied it to your knee.
Yeah, and I think that's really important. Now, the topicals work right away. I know that when I have issues, I have herniated discs in my neck. I know it helps me literally within a couple minutes. I'm getting relief, and that's important. But it just doesn't last that long. If I want it to last longer, I have a couple of different options. One of them is, for example, sublinguals.
Yeah, so sublingual drops can be a really great product. They're very easy to dose, and you can get a very exact dose with that just by counting drops or by measuring on the actual eyedropper. Products generally have a little bit faster onset time than something like a capsule or an edible, and that's because you're getting some absorption right away, sublingually, meaning under your tongue. Swish it around for a minute, swallow it, the rest of the absorption is going to happen in your gut, but you will get some absorption right away in your mouth.
And I think this is important, really, and this will last 4 to 6 hours. Now, the key here is when you take a look at another option, which is oral, a lot of the oral products are absorbed in your stomach, and they can take sometimes up to 2 hours to get absorbed. Although once they get absorbed, they last a long time, 4 to 10 hours.
Yeah, and what we find is this has a lot to do with the patient's bowel motility. So a lot of the absorption is it's happening after the stomach. And so it's all about how fast your body is moving that through your gut. Some patients with a faster gut motility may find that edibles hit them a little bit faster or the capsules hit them a little bit faster. Some people with slower gut motility might find that it takes a lot longer.
Yeah, and I think it's important. Edibles are very effective. The key is be cool, wait. If you take an edible and it doesn't work after about 15 minutes or 20 minutes, wait that hour or 2 hours. We have a saying in this business about the time you think it's not working and you take more is about the time it starts working again.
Absolutely.
So that's something to be very careful of. So there are different ways of taking it. You're not stuck with just smoking. And like I say, try the sublinguals, especially the topicals for arthritis. They help quite a bit. And again, the oral, the gummies and things will help. Just be cool when you're using it. But Amy, dosing is really important as well. In other words, how much people ask, how much do I take? Really, the answer is your body will tell you how much you take. And explain that process to me.
Yeah, absolutely. So, kind of what we want patients to do is to find the lowest minimal effective dose. So, the smallest dose that they could take that will give them the benefits and the effects that they're looking for without unwanted side effects. So, what you're pointing out right now is that target range or that sweet spot. So, as patients are kind of trial and erroring products when they're first starting, we always want them to start at the lowest possible dose. If they find that that dose is not working, then slowly increase it until they find a spot where they have the effects they're looking for. But again, we don't want the unwanted side effects.
Right. I mean, this is a very similar process to what we find with like alcohol and caffeine. Everybody's body is different. I mean, I have friends who can have one drink and they're done for the night. I have other friends of mine that they drink the whole bottle and they're just getting going. Every person's body is different. And this it's true for cannabis, it's true for alcohol, it's true for caffeine. This is really, really critical is to find out, wow, in essence, your sweet spot. Where do you get relief with the minimum number of side effects? And that's something that can be done, but you're right. Go low and go slow or start low and go slow is really the key. Taking that quarter of an eyedropper for a couple of days. If you don't get any release, increase it to maybe a half an eyedropper. Try that for a couple of days. I think the other part of that too is also journaling is important, isn't it?
It really is. So we always recommend that patients keep a journal, at least documenting how much they took, when they took it, when they started feeling the effects, and then how long those effects lasted for.
Sure. That's really great. Now, Amy, we covered a lot of topics from can medical marijuana address arthritis? What products work? What are the studies that are there? And what products can you take? Really, there's a lot of different resources that you can look at for medical cannabis. One of them is our YouTube channel, Marijuana Aware, where we have a number of videos that are out there. And please like and subscribe to this video if you're watching us on YouTube. But Amy, any final thoughts on arthritis?
I really recommend for patients with arthritis, please keep a journal. This is going to give you a lot of helpful information for how effective a product is for you, but also how often you might have to take that product to meet your specific needs.
Sure. That's great. Well, Amy, thank you very much. And for those watching, please, again, like and subscribe to our YouTube channel and join us on Wednesday nights for our medical marijuana and wellness webinars.